Hey guys, I'm Amy Wright, registered dietitian with the Intera Clinic, and I wanted to talk to you today about type 1 and type 2 diabetes in children. We're seeing an increase in this condition with children in particular, and we wanted to let you know the signs and symptoms of what you can do if you do find out that your child does have this disease. I really don't like calling it a disease because I feel like with a chronic condition, you can manage it. So it's not a fatal thing when you get diagnosed. It's something that we can address through diet, exercise, medications. So with type 1, usually that is a child before the age of 18, although we're seeing it even in adults now. But typically it is a thinner, younger patient. Signs and symptoms are going to be excessive thirst, frequent urination. Also, they can be having nightmares at night because maybe their blood sugar is going low. They can have some weight loss. They can also have increased appetite, but they can't seem to gain weight. So these would all be symptoms of type 1. In that case, if you see anything that's unusual, come into the clinic, let us run some labs, and we can make the appropriate referrals. So with type 2 diabetes in children, typically we see a child who is overweight. We see a child who is also having some similar symptoms, excessive thirst, frequent urination, maybe some extra hunger. Maybe they're hungry more than usual. There's also another clinical sign that we look for, and it's a term called acanthosis nigricans. It's not a term you need to remember, but it is something that you need to look for and point out to the clinic whenever you come in. So what that looks like is a brown ring around their neck, or it could be a brown areas under their armpits or in their groin area. So it's kind of a strange condition that happens when a child has insulin resistance. If you don't know what insulin resistance means, that means that you have insulin production. So your body's producing insulin, but something is preventing it from working right. And what improves insulin resistance is improved diet, decreasing the amount of carbohydrate, which we can help you guys with at the clinic, and then also physical activity. Some children may require medication, but usually we address it first with diet and exercise. And with type 1, that child has no insulin production, and we have to have insulin to survive. And insulin's job is it gets the glucose from the food we eat into our body cells to feed the cells. So without it, it can be very, very dangerous, and it can be fatal. So if you recognize those symptoms, they will require insulin. So again, type 1, typically a younger, thinner patient. Type 2 is typically an overweight child. So I hope this information is helpful to you. If you would like for us to meet with you, we would be glad to meet and help with your child that has obesity, type 1 or type 2 diabetes, and help you with the lab work and make the appropriate referrals. If you have any questions, call us at the clinic at 936-634-1400. Thanks and have a great day.